different types of solid tumor cancers. But here comes the problem. Most doctors are not willing to write a prescription for a life extension enthusiast for a drug that's chemotherapy or for organ transplant patients. So the confusion is that most doctors, first of all, don't know about rapamycin, and most doctors that do know about it only know about it as a chemotherapy drug or for organ transplant patients. So that they're not familiar with the dosage regime that provides the health benefits and the life extension benefits. And that all started to unfold with a very unique experiment that was conducted by a physician, Dr. Joan Mannick, who was working at one of the big multinational drug companies. And she had the enviable position when they hired her on. They said, you can research anything you want to research. And Dr. Mannick was interested in the aging process, and she got interested in rapamycin. So she devised a human clinical trial with elderly people, 65 years old and older. And she divided them into 4 groups. There was a placebo group and a rapamycin group taking 0.5 milligrams daily, another one taking 5 milligrams once a week. Another group, I think, was taking 20 milligrams once a week. And then after being on the drugs for a certain period of time, she subjected all of the participants to the seasonal flu vaccine. And then she measured how their immune system responded to that challenge. And the sweet spot was 5 milligrams once a week. The elderly people taking rapamycin 5 milligrams once a week had about a 20% increase in the functionality of their immune system. And for elderly people, getting a 20% boost in your immune system is really a pretty substantial health benefit.